How did early medicine explain respiratory distress? Imagine trying to understand a problem with breathing long before the science of lungs was fully developed. Early medicine mainly relied on observing symptoms and signs rather than knowing what was happening inside the body. In the early 1800s, doctors noticed that some patients suddenly struggled to breathe and described this as a kind of lung swelling or fluid buildup. One of the first detailed descriptions came from René Laennec in 1821, who invented the stethoscope. He called this condition idiopathic pulmonary edema, meaning unexplained fluid in the lungs causing difficulty breathing. At that time, they knew something was wrong with the lungs but didn't understand the exact cause or how the fluid got there. Throughout the 19th and early 20th centuries, doctors used terms like wet lung or shock lung to describe severe breathing problems, especially after trauma or serious illness. These terms pointed to the presence of fluid in the lungs and inflammation but didn't explain why or how it happened. They simply observed that the lungs looked wet or inflamed and that patients had trouble breathing. The understanding was mainly based on what they saw and felt, not on detailed knowledge of lung tissue or blood flow. It wasn't until the late 1960s that medicine started to define respiratory distress as a specific syndrome. In 1967, a group of doctors led by Ishbaugh described what they called acute respiratory distress syndrome, or ARDS. They identified key features like rapid breathing, severe shortness of breath, bluish skin from low oxygen levels, stiff lungs that didn't expand well, and characteristic patterns on chest X-rays. This was a big step because it moved from vague descriptions to a clear set of clinical signs that could be recognized and studied as a syndrome. From this point, scientists learned that respiratory distress often results from widespread inflammation and injury inside the lungs. This damage affects tiny structures called alveoli, which are responsible for exchanging oxygen and carbon dioxide. When these structures are injured, fluid leaks into the air sacs, making it harder for oxygen to get into the blood. This understanding helps explain why people with lung injuries or illnesses, including lung cancer, may develop shortness of breath. Tumors or infections can cause airway blockages or inflammation, leading to symptoms that early doctors could only describe as difficulty breathing without knowing the underlying cause. In summary, early medicine explained respiratory distress mainly through careful observation of symptoms and signs like fluid in the lungs and breathing difficulty. They lacked the detailed understanding of lung tissue and blood flow that we have today. Over time, medical science evolved to recognize that inflammation, injury, and fluid leakage in the lungs cause these symptoms. This progress has improved how we diagnose and treat conditions like lung cancer and other lung diseases, where shortness of breath can be an important early sign. If you or someone you know experiences persistent breathing problems, it's always best to consult a healthcare professional for proper evaluation and care.